Okay, everybody. It is about a couple seconds to 5 p.m. here on Wednesday, August 13th, for our monthly regenerative medicine webinar. Thank you for taking the time to join me today. In the interest of time, I'll get started here. So this here is our couple of recommendations. Number one, if you are able to see me but not able to hear me, may want to improve the volume on your phone or your tablet or your computer. And secondly, if you have questions, this is a good opportunity to interact with me directly and ask me questions, and I'll answer them to the best of my ability. There's a little Q&A icon that you'll be able to click and then ask questions, but I will wait to the end to answer. All right. So what we will really want to discuss here is how exactly stem cells solve pain. We'll start off with a couple of questions. Adeshola from area code 438 says, apart from back pain, can the stem cell be used for other treatments in your clinic? So regenerative medicine is what we do, and what we can do that use them for will be discussed during this webinar, and how exactly they help people will also be discussed. So we will answer your questions there, Adeshola. Elizabeth from 518 says, what are the procedures? What issues can it help? And what are the costs? So great questions, Elizabeth. So very similar to Ashola, we'll explain more in depth about how regenerative medicine is an alternative to surgery. So stay tuned and hope you'll get to learn more from this. Alice from 607 said back and other joint issues. First answer is yes. Those are typical and ideal of what we take care of. But this webinar now is well suited for answering your questions. We as patients, and quite frankly, we as doctors have common goals. And those common goals for us are number one, to avoid surgery, number two, to stop chronic medications. Sometimes these medications can be dangerous or harmful. And so we'd like to stop using them. And number three, we want to improve our quality of life. That's why we're doing this. That's why we're interested in this. And that's why we're pursuing any sort of treatment at all. We all have some common goals. Number one, we all want a plan, whether that be with the physician or whoever it is that we're seeing. We want something to be thought out. We want a plan, but we want that plan to be safe. We want it to have low risk. We want it to have short recovery so we can resume life. And lastly, we want to avoid pitfalls. In what we do here with regenerative medicine, those are the things that certainly we can help deliver and focus on. Let's talk about a couple of familiar examples. Number one is a retired psychologist, flies airplanes for a hobby, is a runner, competitive, but also does it for stress relief. The back pain essentially ended his running. That meant no more competition, no more fun, no more stress relief, and really limited his flying time. There was also a chef who was younger, but really enjoyed spending time with his family. But uh, chef work is hard work, and it's in constant motion, constantly moving heavy restaurant equipment. Really began to affect his work and made his work days difficult, and contemplating changing careers. Traditional therapies miss the target. And I'll say that again. Traditional therapies miss the target. Traditional treatments have limits. And number one, surgery, we think of as permanent, invasive, often having long recovery in order to see any results. Secondly, medications, different types. Steroids, which we've heard of, otherwise known as cortisone, is a band-aid. They weaken, they damage tissue, meaning that if you repeat the steroids, you're repeating the weakening and repeating the damage. Over-the-counter medications, your Advils, your ibuprofens, certainly they help lessen symptoms, but the effects wear off, and then you've got to then repeat the dose. 2 months after stem cell therapy, our psychologist was back to running. Ran the 4th of July race, a 4-miler race at a 13-minute pace, gave him enough confidence to train for a half marathon with his grandson, which was, in the end, the ultimate goal. The chef was back at work full time, able to provide for his family, continuing to do the work that he enjoyed doing. So, how exactly do we do that? We do it by breaking the cycle. When you have pain, you have degeneration. And when you have degeneration, it leads to further pain, and then so on and so on. So, what we really do is we're the third solution, not surgery, not medications. What we have in regenerative medicine is something with a high success rate. And this isn't just in our office, this is pretty well established. And what we have in regenerative medicine also is something that gives you years of relief, and there is a guaranteed acceptance. We're taking cells from you back into you, therefore you can't reject it. So what exactly is regenerative medicine? Regenerative medicine is a new field of medicine. The goal here is to restore but not replace the tissues, unlike surgery. Damaged tissues into healthy, functional tissues. Different materials that we use to help restore this health include number one, platelets, and number two, stem cells. How do we decide? Platelets are more for the green and yellow circle, let's say small, medium problems. Stem cells for yellow to red, which would be then medium to larger size problems. So if you can sort of think about that as levels of severity. Here's a nice little video clip of how cells move throughout the body, where the red is seen as bad and green as good. The red is really what we experience as people, as patients, as those who are doing activities. We see it as pain, stiffness, sciatica, nerve issues, shooting type symptoms, aching, grabbing at times. What we do with regenerative medicine is similar to what I like to call the Pac-Man problem and solution. If you could think about the pellets in Pac-Man as inflammation, one Pac-Man eating one pellet at a time is similar to platelet-rich plasma. But if you leave many Pac-Man on the screen to eat many pellets all at the same time, that's what stem cells do. Goal here not to get to the next level, but to leave the whole inflammation game and problem behind. How well does this work? Anywhere from 5 to 10 years worth of relief. Where exactly do the stem cells come from? So the spinning bone image on the left-hand side of the screen is the pelvis, and where we take it from is on that backside as it's coming to you now. And we're able to process it and then re-inject it into places like the spine on the right side of the screen. So here's our typical timeline and schedule. For us, we'd like to meet you. That consultation is critical. It's an essential piece to this. Somewhere along the line, we'll get an MRI and then the first platelet-rich plasma or first injection. Soon after that, then the second platelet-rich plasma, which is where the stem cells are introduced. And then lastly, the third PRP. And then from there on, physical therapy, chiropractic care, exercise, back to quote unquote normal routine in life. So what can we help? So when it comes to the neck and back, we can treat things like stenosis, arthritis, degenerative disc disease, and sciatica. In the lower body, we're treating things like arthritis, bursitis, meniscus damage, Achilles tendon issues. We just treated one earlier today. In the upper body, rotator cuff, arthritis of the shoulder, tennis elbow, carpal tunnel. A lot of people want to know, are they a candidate? Anywhere that can be injected or operated on is amenable to stem cell therapy. So the other way to think about that is if a needle can reach there, I can inject it with stem cells. What's important for us always is diagnosis. If you have an accurate diagnosis, I have an accurate location, and therefore I'm able to apply the accurate therapy. And of course, for us, all of our therapies, all All of our stem cell therapies include MRI as part of the process so that we can ensure the accuracy of both location and quality of therapy. Let me see here. Okay. What if you've had surgery? And the answer is yes, you can still have regenerative medicine, stem cells, platelet-rich plasma, but it depends. So what's important is the consultation. During that time, if you have notes, if you have information, if you have some history of knowledge of what was done to you, we can then help navigate towards if this is or is not possible for you. So during that consultation, diagnosis, imaging through history and exam is important. Type of surgery is also going to be important. Was this an arthroscopy? Was it a fusion surgery of the spine, rotator cuff surgery of your shoulder? Some frequently asked questions. Number one, where will my stem cells come from? And as I showed you in that screen earlier, they come from you back into you. How long before I can become active? At that third injection, when we initiate chiropractic care, physical therapy, is when you're allowed to return to all your normal activities. When do I feel the benefits? I'll say generally about 60% of the time, people feel the beginnings of the changes in pain by the time the third injection happens. How long will the tissue stay repaired? So depending on what we're treating, anywhere from 5 to 10 years. How well does this work? So this part is very difficult to answer just over a webinar, but works incredibly well. But it is tailored to each person and also tailored to what part of the body we're treating, whether it be the neck or the low back or the knees and the hips. All right, so we'll get to some Q&A here. Dennis from 315 said, I've been told that I have degenerative disc disease. I'm very active. I'd like to stay that way as long as possible. I'd like to learn more about your treatments for my lower back. So, Dennis, the way we like to explain this is that the disc is basically a jelly donut. And if you've got a jelly donut, you have degenerating, and if you have a jelly donut and you have degenerative disc disease, it is the slow leak of jelly out of the donut. If we can help the donut, we're helping the disc. And if we can help improve the disc, we're helping the spine function and mobility, and then ultimately the quality of life. The stem cell for us specifically is helping stop the jelly from leaving and creating a more intact donut. And obviously, if you have a more intact donut or disc, you have a more functional disc. Okay. Next question. Martin from 514 says, info on back pain and relief. Again, Martin, regenerative medicine is incredibly well suited for back pain. This is the predominating thing of what we do. For back pain, we're treating degenerative disc issues, herniations, and I write listhesis. So there's different types of listhesis: anterolisthesis, retrolisthesis, arthritis of the spine. If you've ever heard these sorts of terms before, regenerative medicine is for you. Uta, I think I'm saying that right, said from 647, I've got spondylolisthesis in the lumbar spine and I'm in constant pain due to nerve compression. Also, my legs are numb from the knee down and various nerves. Sciatica, lumbar, etc. are giving me hell. Sorry to hear that. I live in Costa Rica, but would consider traveling to get your treatment if there's hope. I'm a holistic home birth midwife. Very cool. 83 years young, still practicing and otherwise in very good health. I hope to one day follow in your footsteps there, Uda. But for spondylolisthesis, this is a very common problem that we treat. And the way I like to think about it is when you have spondylolisthesis, basically you have shift of vertebrae one on top of another. So let's just say this is anterolisthesis and that is retrolisthesis. But that interaction where the space is in between my hands is where the disc should be. Once you make that shift, there's a disruption of the disc function because nutrition happens through the bone, through the vertebrae, into the disc. Therefore, when you're able to still treat the disc, you can help improve the quality and function. As far as being an international patient, not a problem at all. We have travel protocols, itinerary. We've had patients as far as France come to us. We have lodging recommendation, dining recommendations. We have many Canadians that come to us, so this is not a difficult task for us. Luis from 518 said, treatments available for chronic back pains and general information on stem cell therapy. I'm a Canadian citizen. Hope I could be accepted. Nevertheless, thank you. Luis, absolutely. The fact that you're Canadian, not an issue. We treated a Canadian just moments ago. So our office in Plattsburgh is well suited for you. And about 45 minutes from downtown Montreal to our office, assuming customs is relatively quick. What regenerative medicine is, and what we have and Canadians don't have, is the fact that it is minimally invasive. It is done in office. Only local anesthesia, oral sedation only. Therefore, you're able to walk in, walk out. It is a much quicker process, a much shorter recovery than, for example, things like surgery. Done with infiltrations only, no cutting, no sutures, no big production operations. And again, unlike surgery, it's also not permanent. Next question. Kimberly from 518 says, I have been diagnosed with L2L3 and L405 disc herniations. This is causing sciatic pain and numbness from my right buttocks down my leg to my foot. I'm scheduled for a consultation with you in early September. My daughter's wedding is mid-October. Will it hurt or delay my case if I get an epidural steroid injection for pain relief for the wedding? So really good point. So steroid and regenerative medicine, at least for our practice, our general rule is avoid steroids 1 month from any regenerative medicine therapies. So I will say for you, keep the consult, enjoy your wedding, and get the steroid injection if you have to, and we will plan our therapies accordingly. So 1 steroid injection for the purpose of the wedding, go do it, enjoy the wedding, and then we'll make sure that the plan is ultimately safe for you. Bruce from 518 says, severe lower back injury. So here's a diagram of somebody getting injured, but we like to often think about injury, at least I do in our office, as epicenter, meaning one spot in the disc and then collateral damage. So 1 spot in the disc, you'd start developing arthritis, tendon issues, ligament issues. And so for us, we have developed our treatment protocol to include addressing and treating all of these separate areas. So not just the epicenter, but the collateral damage as well, which is also why there's as many injections as there are over 6 weeks. Certainly for those who say, well, I've never had a severe injury, well, what about me? So I do also believe in micro versus macro trauma. When we think about macro trauma, the car accident, we think about this big, horrific, obvious injury. But the micro trauma exists too, where you do the same thing over and over. So let's say, much like the chef I talked about earlier, that repetitive, heavy lifting, where even though you're in pain, you got to do the work. So you continue to create these small micro insults to the spine. So for you, Bruce, I would certainly say consultation is key. We've helped many individuals with micro and macro trauma buildup, both with only epicenter and those with epicenter and collateral damage. Diane from 845 says back issue, sciatic and bulging discs. So for us, certainly these things are all related. When you have a sciatic plus bulging discs, we think about these as most likely having some element of degenerating disc. Think donut, jelly, leaking, irritation to the sciatic nerve. What we do is the non-surgical alternative, completely done in office, walk in, walk out, something that gives you pain relief for years. Important key next step for you would be consultation. If you have imaging, great. If you don't, that's okay. We can help with that as well, as we have our own MRI machine. Robert from 518 says non-invasive surgery for lower back issues. So this is also a good moment to talk about things like surgery and why surgery is maybe not the greatest thing. Surgery can lead to what we call adjacent segmental disease. The way we like to think about that is links in the chain. So if you have a bike chain, two links, and all of a sudden you fuse them shut, then the link before and the link after have to increase flexibility for the one you lost in the middle. That means increased motion, increased force, increased workload, and then the discs adjacent before and after now are going to break down quicker or faster. So with our method, very different than surgery, no added metal, no plastic, no foreign bodies, no locking things into place. Everything that we do is materials that come from you and go back into you. Michael from 315 says therapy for neuropathy in my leg, causing balance issues, arthritic shoulder pain as well. So balance is a little bit complex. There are multiple things that make up your balance. Everything from nerves, muscles, your inner ear. So for somebody like you who's having neuropathy and balance issues, I'd want to know where your leg neuropathy is being driven from. Is it because ultimately you have an issue in your back? So we talked a little bit about epicenter and collateral damage. Here's a great example of that. Shoulder arthritis, absolutely something we treat and treat very frequently. Again, consultation being key for you, Michael. Scott from 617 simply said joint pain treatments. Yep, joint pain, very well established in the musculoskeletal regenerative medicine stem cell world. For us, at least, we're seeing 5 to 7 years of durability, sometimes longer in terms of pain relief. For you, important to get a consultation so that we can review things like your function, things like your imaging and examination as well. Michael from 202 said, does stem cell therapy help back pain caused by arthritis? Can thyroid disease be cured from this therapy? So I will tell you that the majority of what we're doing is spines, back pain, arthritis of the knees, hip, etc. What we're going to call musculoskeletal problems. Non-musculoskeletal problems, let's say the thyroid diseases, the Alzheimer's, we're not able to treat. Miriam from 514 said meniscus cartilage knee regeneration. So this isn't so much a creation of more meniscus cartilage. Think about this more like a room, and somebody comes in and punches holes in the wall. If you punch holes in the wall, all the debris gets into the floor, and it's very difficult to get from one side of the room to the other. So if you have cartilage damage, whether that's on the joint cartilage or in the meniscus cartilage, it creates this debris, the debris being inflammation. What the stem cells are really, and the platelet-rich plasma are really good at, is they're going in and clearing that debris. So if you can clear the debris, you can walk from one end of the room to the other. What you're not doing is patching the holes in the wall. You just simply want to walk from one side of the room to the other. And that's what regenerative medicine is able to do. And what we do is, being a non-surgical method, having years of relief, 5 to 7 years. My camera moved slightly. Okay. Next question. Nora from 803 says alternative to surgery for knees. So this is an excellent alternative to knee replacement and knee surgeries, including meniscus surgeries. So great for knees, hips, shoulders, ankles, elbows, thumbs, just to name a few of the places that we've treated. We just treated an ankle earlier today. For you, consultation is key. Want to know more about you, what you want to do, what kind of activities you like to do, and whether or not this is appropriate for you. Krista from 315 said, what conditions do stem cells work particularly well for? How many treatments on average do patients require for these conditions? What is the range of treatment costs? So details are incredibly important here. So what are we treating? How severe is it? Do you have a loss in mobility? Do you have any imaging? So stem cells work for a variety of conditions, but how well they're going to work for you really depends. Cost, protocol, depending on all of these factors, as you can imagine. That's like one of my favorite analogies is asking a mechanic, calling them and saying, I have a sound in my car. How much is that going to cost to fix? It's impossible to say. The mechanic's got to take a look at your car, put it up on the lift, etc., inspect it. Sarah from 315 says, can you treat plantar fasciitis? Absolutely, yes. In fact, we just met somebody yesterday who is going to be treated for plantar fasciitis with stem cells. Typically have excellent response to regenerative medicine. For us, the most important question is how long have you had it? So consultation is important so we can help figure some of this out. Don from 718 said, learn about surgical alternatives, treat a bone-on-bone right knee producing pain and swelling. This is an excellent alternative to surgery and knee replacement. Walk in, walk out, no general anesthesia, no hideous scars afterwards. Overall, a much simpler process. Consultation for you are going to be a consultation and imaging are going to be the key next steps for you. A lot of people mention bone on bone, but what we often find is that true bone on bone is pretty rare actually, and that these kinds of terms typically used by other clinicians are overused, quite frankly. So come on in and let us see the real level of damage in your knee. Robert from 705 says, are we using the patient stem cells, the length of time for regeneration, the approximate cost? So, Robert, what we do is something called autologous stem cells, meaning they come from you back into you. Allograft stem cells, which means come from another person back and then going into you, are by and large not allowed in this country. Our therapies last years. For us, consultation gives us the opportunity to figure out exactly what your needs are and help us figure out exactly what's going to be the most appropriate therapy for you. Linda from 585 says, I have 3 lumbar discs, lumbar 3, 4, and 5, which are compressed on myelogram and follow through CAT scan. My low back and tailbone are in such pain most of the time. Sorry to hear that. Discs are bulging and many Schmorl's nodes are seen. Can you do anything for me? Absolutely. So we can, believe it or not, we can treat as many as 4 lumbar discs at any one given time. So very much possible. Schmorl's nodes, for those who don't know, Schmorl nodes, instead of herniating sort of front to back, is a herniation basically going up and down. And yes, such a thing is possible. Obviously, consultation being important. Dave from 518 says hip pain in the lower back. So hip pain, back pain, tons of overlap. Sometimes what's back pain actually looks like hip pain, and what is actually hip pain actually looks like back pain. Again, why consultation is key. We need to be able to differentiate that. By and large, through a consultation, just by listening to you, examining you, I have pretty good confidence about which of the two you might have, and in some people, believe it or not, have both. John from 413 said, is there a way to correct the constant pain, numbness, and tingling in my feet? So this is a great time to talk about what discs and nerves and why you get this pain and numbness. So here's a cross section, what we call a cross section of your spine. The blue is the disc, the red is your spinal cord, and the yellow is the nerves as they head down towards your body. If you can see the close relationship between the blue and the disc and the yellow of the nerves, you can see how when a disc degenerates or pushes into that region of where the yellow nerve should be, how that can create things like pain, things like numbness, things like tingling, that wires as it's the wire is meant to carry signal all the way down to the feet. So for us, reducing the disc pressure helps reduce the nerve pressure. Of course, consultation being important here. Melanie from 315 says, several years ago, I had a total knee replacement. Due to a buildup of scar tissue, my recovery was long, painful, and honestly traumatic, I can imagine. I'm currently a candidate for total knee replacement of my other knee, as my orthopedic surgeon has said there's nothing more he can do. I'd like to learn about the benefits of stem cell therapy and how/if it can help to eliminate knee pain and repair my deteriorated cartilage. I'd like to avoid surgery and am exploring alternative options that could rid me of my pain. So absolutely. So very, very familiar scenario for us where patients had one and for many reasons had a not so great experience, pretty horrible experience, and then obviously not looking to repeat that. So this is an excellent pain relief option, non-surgical, short recovery, lasting 5 to 7 years, very much repeatable. We do our own MRIs, so don't even worry about the imaging. And just a nice little segue. If anybody knows in the 315 area code, Walt Patulski, he actually came to us with this exact same story, where he had replaced one knee, had a terrible experience with it, and then decided stem cells in the other, and had great relief for years. Marge from 315 said, would stem cells treatment help chronic arthritis pain in the neck and SI joint? Absolutely. So we do this for neck and SI joint. In fact, saw an 80 some odd year old man who 4 weeks after stem cell of his neck had 85% pain relief just today. Degenerative disc, arthritis, very ideally situated. This is the one of the key diagnoses that more common diagnosis we see in our office. Ultimately, improve the disc, improve the spine. If you improve the spine, you improve the quality of life. That's it. Straightforward. Sybil from 778 said, I have severe osteoarthritis, hip and knees, plus a labral tear on your left hip. What can be done, and approximately what would the cost be? By the way, you are asking about phone number with area code, but only allow 7 digits of space. So sorry about that. Not sure what happened there. Generally, there should be a space for 10 digits. So hip, knee arthritis plus a labral tear, very frequently seen in our office. Most of the time, if you have hip arthritis and labral tear, no surgeon wants to repair the labrum because you've got the hip arthritis as well. So for those who don't know what a labrum is, basically if you took a paper coffee cup, that rolled lip edge on top would be the equivalent of a labrum. A couple of different ways you can tear the labrum. You can cut it, so you're tearing this way, but you can also cut it underneath, so you're peeling away from the coffee cup. At the end of the day, it's cartilage. If you've lost cartilage because of a labral tear, or you've lost cartilage because it's the joint side of the cartilage. A lot of people who have osteoarthritis are also going to have joint and bony edema, and that's an important part to recognize and treat, as we find that treating these things along with the loss of cartilage to really improve success. So major difference between regenerative medicine and surgery. Surgery for something like a labral tear with osteoarthritis, unlikely to happen, probably shouldn't happen. Regenerative medicine addresses cartilage. Doesn't matter if it's labrum, doesn't matter if it's articular cartilage, addresses them both, all at the same time. Consultation is important. Sammy from 514 said, treatment for back pain, treatment plan and cost. So back pain. So this is a good time to talk about saying simply back pain, but what exactly is your back pain from? Is it arthritis? Is it degenerative disc? Did you have a recent herniation? Did you fall? So these are the sorts of things we really like to tease out during a consultation because it really helps us make that diagnosis and figure out what is it that you need. Do you need stem cells? Do you need platelet-rich plasma? Do you need it in your disc? Do you not need it in your disc? So what is causing your back pain? That really, for us, defines what sort of options we can offer you. But ultimately, when we do things like stem cells, for example, things like degenerative disc disease, we're getting 7 to 10 years of relief. Patricia M said from 315 says, how can you help nerve pain in the upper extremities? So going back to the um, epicenter and collateral damage idea. So very similar anatomy to the neck. I showed you with the blue of the disc and the yellow of the nerve. Treat the disc, treat the spine, quality of life. So I guess the question for you is nerve pain in the upper extremities. Is it simply in your upper extremities? For example, is it in your elbow? Is it in your thumb? Is it in your hand? Or are you having a component of neck pain? So neck and nerve versus nerve-only presentation is two very different things and very difficult to assess, obviously, online. But in person, we can tease all that out. Andre from area code 514 said, I'd like to see one of his webinar. I have a severe stenosis, have an MRI, but it is in French. I'll get you the CD and have a low foot with torn tendon. Took an appointment 9th of September. Would like to know how much is the cost if I call somebody. Can somebody explain to me? So for those who don't know what stenosis is basically a tunnel. Sorry, a foramen is a tunnel. And when the tunnel narrows, that's what stenosis is. So if you obviously have a nerve running through there and you have a tunnel, fine. But when the tunnel starts to close on that nerve, that's a problem. So for you specifically, Andre, stenosis, we can help. If you have an MRI, a disc is great. In French, not a problem. We can translate. Torn tendons of the foot, we can probably help, but I would probably ask uh, for any imaging if you have available for that. Consultation's free. Okay. Nicolino from 514 said, I'd like to have a better idea of what options procedures are available, success rate, risks, etc. So risks, like any other injection, injury to nerve, artery, vein, muscle, bone, tendon, possibility of infection, touch wood. We've had incredibly low rates. Surgery versus something like surgery, where you have to undergo general anesthesia, you have to undergo hospitalization. So some problems obviously come with those things. So to talk about success rates, hard to know, Nicolino, without actually meeting you, and we'll see what we're talking about. Are we talking about the spine? Are we talking about a joint? Have you had surgery before in those areas? These things change success rates. But I'll tell you what doesn't matter. What does not matter is age. Age of the patient does not matter. Timeline of the pain. We've helped people who are in their 90s. We've helped people who've had decades worth of pain, people who are in mild pain, people who are in incredibly severe pain. There is a fairly wide application of regenerative medicine. So a lot of people are sometimes concerned that they may not apply. But I will say by and large, we've been able to help a wide spectrum of people. Michael from 585 says, will stem cell and or PRP help spinal stenosis? So go back to that last conversation I had about stenosis in the tunnel. So again, stenosis, likely you have some level of degenerating disc or arthritis. Regenerative medicine is very well suited. If you can have a functional disc or a functional canal or tunnel, got a functional spine. Functional life comes along with that. Okay, Nancy from 514 said, I have DDD in my neck and arthritis. I'd like to know if stem cell would help me. So here's a good moment to talk about how the disc receives nutrition. The disc has no blood supply. There's no arteries, no veins that go to it. So how does it get its nutrition? The nutrition happens from the bone above through what we call that cartilage end plate, circled in red, and then passively, what we call diffuse or passively filters into the disc. So when you imagine a disc that has damage, the repair is very difficult because there's no artery feeding it with food, feeding it with materials. So my analogy is a cabin in the woods. If you build a cabin in the woods and no road to get to it, once it starts to break down, how do you repair it? Think about stem cells, think about platelet-rich plasma, think about what we do as airdropping supplies right onto the cabin so you can repair it. And then obviously at some point in down the line, let's say 7 to 10 years, this may need to be repeated. Okay. Ralph from 904 said, is stem cell therapy successful for treatment of a torn meniscus? Thanks, you're welcome. Absolutely, yes. Torn meniscus responds very, very well. For us, it's incredibly important to preserve the meniscus. Very well established that once you've had a meniscus surgery, you are 6 times more likely to need a total knee replacement. So question is, do you have imaging? And don't think that just because you've had meniscus surgery, this is not available to you. It absolutely is. Don from 718 says non-surgical alternatives to knee replacement. Yes, excellent result lasting years, unlike cortisone. This really helps stop or slow the progression of the arthritis, which is also important. We want to help keep as much of that cartilage as much and as long as possible. Michael from 514 said, problems in my right shoulder for years. Do you also do shoulders? I understand that you take an MRI to know what the issue is. Do you need to still take it if I have a recent MRI done? What would be approximate cost for stem cells for the shoulder? Thank you. So for us, shoulders have had excellent outcomes. We have not had a shoulder fail in years, touch wood. If you've had a recent MRI, no issue, come with it. If it is let's say greater than a year out, there's a good chance we may want to repeat it, but not necessary for the consultation. What's important here in regenerative medicine of the shoulder is that stem cells have been shown to fully heal partial tears, which is different than cartilage. Cartilage, room, punch holes, debris, different. Our question to you is going to be, how badly is it torn if you have a tear in the shoulder? And what is your level of function? Arlene from 518 says, asked, do your treatments help with balance, stability, leg strength? Right? We talked about this before, epicenter, collateral damage. So for understanding purposes, nerves control not only balance, but the stability and leg strength. So the nerves are really the wire from the light switch to the light. Question is the wire pinched? Is the wire pinched in your spine? Back pain? Do you have gluteal pain? Do you have reasons for nerve damage? These are some very important details. So while I want to say, yes, we can help balance stability and leg strength, can it help your balance, stability, and leg strength? We could potentially find out through a consultation. Linda from 518 says, I just want to learn about the process of regenerative therapy. Hopefully this has been helpful. I won't read all through all of this. It's very unlike surgery, very unlike cortisone and steroids. We really think that it is critical to have these webinars, critical to have the consultations where we can really explain how the whole process works, but it is different. Shorter recovery, back to quality of life sooner. Hope that this was informative. Aaron from 561 says, I have a right foot drop, pain in my lower back, down my legs, into my feet as a result of nerve damage. L3 to S1. I'm wondering if any of these things would cause an issue with your process. Number one, Abbott Proclaim spinal cord stimulator implant with electrodes. Number two, unit has some kind of error preventing MRI. Previously, only a low Tesla MRI was approved. Apparently, I can only have the electromyogram imaging instead of an MRI. I'm about to get another cortisone epidural at the L4 nerve room. So back pain versus nerve dysfunction, very important. Am I helping your back pain? Are you looking for resolution of the nerve dysfunction? Permanent nerve damage cannot be resolved. Not from me, not a surgeon, not any other pain management person. Once a nerve is permanently damaged, it is done. In terms of your requirements, spinal cord stimulator, treat people with SCS all the time, not an issue. MRI, don't worry about it. We have our own MRI. We have other ways of getting imaging so that I can get the information that I need. About to get a cortisone epidural. Again, 4 weeks between any cortisone epidural and any regenerative medicine therapies. Louisa CS from 518 says, what exactly happens at the 3 sessions for my 2 knees? Does Dr. Kim take stem cells from my pelvis or hip bone each time for each knee? Does he need an MRI for my left knee since he only has one for my right knee from Ortho New York? So you saw the sequence. It went PRP, stem cells, PRP. So no bone marrow only taken at the second one. We typically take that at the posterior of the pelvis where we can find that spongy bone. You could see that faded picture to the left. We will do an MRI of both knees if one has not been done recently for either knee. So we may repeat both, in fact. Brian from 518 says, solve my sciatica. Again, sciatica is about nerves, and nerves are about where the damage takes place. So what you're really experiencing is something called referred pain. Where is the wire pinched? A lot of times, if they're pinched at the spine and the disc, regenerative medicine would be perfect for you. The word cure really depends on whether or not you have permanent nerve damage, as I was mentioning before. So permanent versus not, temporary. And we can help figure this out during the consultation. Okay, so Don W from 863 says, will the fact that I have scoliosis affect the possibility for treatment of my back and leg pain? I've already had an MRI. I don't imagine my insurance will pay for another one. So scoliosis does not affect our outcomes. We see people with scoliosis. Scoliosis in general is slow progressing and not painful. I should have written until it is. So even though you have scoliosis, doesn't mean you can't have degenerative disc disease. Doesn't mean that you can't have arthritis. So entirely possible. So the scoliosis just may be a distraction, and in fact, your problem is degenerating disc. Consultation, MRI, no concerns about the MRI. If you have your disc, please bring it. Again, MRI is included in our process, so we do like to repeat that when we do our therapies. Maureen from 518 says stem cell and Parkinson's. Unfortunately, Parkinson's, we don't treat Parkinson's and systemic nerve issues like Alzheimer's with stem cells. There are perhaps trial therapies out there. Clinicaltrial.gov is a good place to find such trials, but you would again be entering a trial and not a direct therapeutic. As far as I know, there's no current protocols that exist in the general public. Scott from 617 said general information. Scott, I certainly hope that you thought that this was helpful. Consultation will certainly give you a more personalized explanation. Patricia from 518 says percent success treatment for arthritis in the knee. Simply for blanket statement, I'll say generally excellent, but it is highly individualized. I don't know what your knee looks like. I don't know what your level of function is like. We're going to need to see these things. So X-ray, MRI, if you have it. If not, we can help you with that. But a consultation will and likely change what I think about the success for you will be. Marilyn said from area code 518, recently diagnosed with scoliosis. So yes, again, talked about scoliosis from before. Those with scoliosis, generally not painful, but doesn't mean you can't have degenerative disc disease. Doesn't mean that you can't have stenosis. So an important part. So consultation and imaging. Claire from 518 says, are the treatments typically covered by insurance? Do the treatments include physical therapy type exercises? So insurance does not cover these types of therapies. Physical therapy is done locally to you. We will find you a physical therapist, and we have a broad network of therapists as we've been doing this for 10 years, who are very familiar with our system. Um, important thing for me, I like to tell people is that we can inject for pain. We can't inject for strength. You have to build for strength. Rosemary from 518 says stem cell applications. Again, musculoskeletal, spine, neck, knees, hips, etc. I will let you know that there is a exponential increase of research, and the quality of the research is getting better. Consultations for anybody thinking that this might be applicable to them. Gary from 253 says, love keeping up what you're working on and learning more about regenerative options while going through fellowship. Gary, love to hear from you. I appreciate you. And not sure if you'll be there, but at the Orthobiologic Institute meeting in Las Vegas next week, I will be there to learn more about this wonderful science and how we can serve our patients better. All right, that concludes our slide portion. For anybody who's watching a webinar, extend to you a free consultation. In order to have that, scheduling by Friday is critical. Please mention webinars and schedule your consultation. September 17th is our next one. Some contact info for you. Phone number here, 518-871-9900. And for those north of us is 514-697-8919. Web page is richardkimmedicine.com and /webinars for either any future webinars or prior, and /MRI if you're interested in scheduling your own MRI. All right, and we have a few questions already, so I am going to get to them. All right, going to the very top here. Sibylla says, what about fairly severe osteoarthritis, knees, hips, and shoulder? So yes, absolutely. So I know it might seem um, uh, hard to believe, but we've absolutely helped with people who are on the brink of having a knee replacement. So severity of osteoarthritis, believe it or not, doesn't limit the application of this treatment, doesn't limit the success of these therapies. Andre says stenosis severe in L4 to L5 and tendon is torn. Yep, Andre, so we can help you with severe stenosis. We can help you with torn tendons. I will say though, when it comes to the torn tendons, we will need to know how severe the tendon is torn. So that's an important part for us. Alice Anderson is next. If I have a consultation, how long would it be to come back for the MRI? Alice, it depends on which office you are reaching out to. If you come to our Saratoga office for the consultation, you could have the MRI in the same day. Sibylla again said, I've asked my MD to refer me for hip surgery and or knee. Worse is my left hip, which also has a labral tear in right knee, constantly swollen and inflamed. Have an MRI. Yep. So Sibylla, same thing as before. We're able to certainly provide you with a consultation and take a look and see if we can help you. Louisa says, my knees are one of the problems, but I also have lower back problems, and my neck keeps cracking, and I have to keep getting adjustments to relieve headaches. Not sure what to tackle first. Really good question. Although I saw you for my knees, so I'm still wondering if my neck is in worse shape. Yeah, if everything is equal, I tell people start from the center and work your way out. If you're not sure, treat the worst one first and then go from there. I hope that makes sense. So if, for example, your ankle is awful and your low back pain is only modest, then I'd say it's important to have a good ankle so that you can rehab when it comes to your back. But if the two things are the same, start with the back. So hopefully that was helpful. Okay, and I think that's all the questions I have right now. I'll wait another minute or two in case anybody wants to put up a question. So Alice, if your Alice asked the question, consult or replied to my question, I should say. Consultation is in Skinny Atlas. So if your consultation is in Skinny Atlas, your MRI could be had as quickly as the next day. A couple more minutes for anybody else. Okay. Alice says, thank you. Alice, you're welcome. Luis said, should I get an MRI of my neck? Yeah, that's a really good question. If you're interested in having as much information as possible, I would say yes, have the MRI with you. Or even if you have an X-ray with you, that would certainly provide me with just that little bit more of how severe is this? How well do I think this is going to work? If you've seen me here, you can have an MRI in my office for your neck and see me the same day. That's certainly possible. And we've had people utilize that timing so that you're not making multiple trips. But overall, I would say some sort of imaging, not necessarily MRI or X-ray would give me the information I need. Okay. Let's see, any other questions? Okay. I'm going to say that is the conclusion of our webinar. And thank you, everybody, for attending.